Both men and women can experience hair loss as they age. There's no magic pill that replaces hair, but an effective way to get hair and keep it is through hair restoration. Dr. James DeYarman, a hair restoration surgeon from La Jolla, California, discusses in this two-part segment the skill and natural-looking process he uses in his hair restoration technique.
If a person's bald, and he's been bald for many years, and you start to give him hair back, he immediately will start to look younger. And when he starts to look younger, then he wants to take better care of himself. And you'll start to see guys, losing weight, looking healthier, feeling better about themselves. So it's a very positive change that occurs here. Nobody wants to lose their hair. You'll see guys, talk to patients that, hair loss doesn't bother them. But I can't imagine a guy looking in the mirror and saying, oh, I'm finally losing my hair. Well, when the patient comes in for the consultation, we first want to find out what their objectives are. Are they wanting medical treatment or are they wanting surgical treatment? If they want surgical treatment, to what area of the head do they want to add hair? I always find it interesting, for example, a guy that's completely bald. If you ask them where they want to add hair, you would think it would be in the front. But most guys will say in the back because they just don't like that bald spot. So you have to understand what their objectives are, what they want. And then from there, we start to take photographs. We analyze their hair. We try to get an idea of their density. We try to predict their hair loss pattern. We can wet their hair down, take photographs. You'll start to see the thinning areas. We start then to formulate a plan. And then we can tell them and show them on the computer what we think would be, a good look for them, where we should place the hair. And they start to get a feeling of what they hope to expect from doing a hair transplant procedure. This gentleman has had hair loss, plus he's had previous cosmetic surgery. So not only did he have hair loss on top, he also had hair loss on the sides of his head from the facelifts that they did. So he did a complete reconstruction here. Added hair on top, plus rebuilt the temples, the sides, and the sideburns.
When you're bald, it makes you feel bad about yourself. It sounds strange, but that's the way it is. And since I've had the transplant, I just feel better. I feel younger. I look in the mirror. I go out. I feel proud. People come up to me and they don't realize it, and they say, Dave, what have you done? You look so much better, without realizing what the true story is. He uses two techniques. One is so the hair will fall down better, so it looks more natural, and the other one helps the hair look fuller. And anyone else I went to, no one else did these two procedures, and that's basically why I selected him.
This man came to me with complete baldness, and this represents one procedure of where we transplanted approximately 4,000 grafts in one session. And these are follicular units, transplanted at around 40 units per square centimeter.
The first time I went back to the barbers, because I'd always cut myself, or cut my hair myself, and I went to the barber and I told her, and she just couldn't believe it because it's just so natural, and that's what I like, because each follicle goes in one by one. It's not the old-fashioned way.
You can't tell it's hair transplanted hair. I tell people this: if I were to give you an injection with a needle, and I pull this needle out, can you find where I stuck that needle in? And the answer is no. Well, that's the size of the site that we're going to create on your scalp. It's less than 1 millimeter in size. So when it heals, there won't be any scarring. The only thing is when it heals, there's now going to be hair coming out of this area, and it'll look like your own natural hair growing in that area.
Do I have to say how it makes you feel? I mean, look at me. Look at me. I mean, yeah, it makes you feel great. It really does. It does. I would highly recommend it to anybody who wants to do it.
In this next part of our interview, we asked Dr. DeYarman if your hair will be as full again as it once was.
The answer is no. I wish I could, but you just can't. The hair restoration today, when we transplant them one time, we can restore them to 50% density. Now, many times that's all that's needed to satisfy the patient's objective. But if they want to, they can come back and we can add more hair to the situation. But we'll never achieve 100% density. And you don't have to. You know, the patient will look normal, they'll look, you know, like they have their own hair, and it will be, you know, really what they're looking for as far as hair restoration is concerned. If a person's completely bald, they not only lose hair on top, but they lose hair on the sides of their head, in the temples and the recessionary areas. So if you're going to start bringing out a hairline, you also got to bring these recessions out too, where it won't look natural at all. So you're able to point this out to the patient. There's a lot of art involved in creating something that when you're all done, people look at the patient's eyes, not at the hairline. That's your whole objective here. And if you pull this off, well, the patient's going to be very happy with what you've done for them.
The whole process is so gradual because you have the transplants done, and then it's, you know, 6 months really to a year before it comes in. So for me, I was cutting my hair very short, and then I just let it grow out. And so that process of letting it grow out and having people see that, they didn't notice. It's so gradual. It's not like a toupee where you show up one day and you don't have hair and the next day you do. So from that perspective, I don't think people even noticed. And had I not said anything to people, they probably would have never noticed.
This man had severe hair loss and was turned down by many hair loss physicians. We did 2 procedures on him, and as you can see, he looks much younger with hair than he looked without hair. This is a case where we're adding density, and he had a thinning over the whole entire top of his head. And with one procedure, we were able to add more hair to the thinning area, and along with Propecia, keep the hair that he's losing. This is a young man that represents 2 procedures, where we went in and did 1 procedure. He came back 1 year later, added more hair, and this is a result of 2 hair transplant procedures. This is an example of crown restoration. What's important about crown restoration is following the direction of hair, because you have to recreate the whorl. And the use of lateral slits is the best method of utilizing hair restoration and treatment of a patient with this situation. This is an example of a young man losing his hair, and this is a result of 1 transplant procedure.
From beginning to end, by the time I saw hair growing back on my head where I no longer had hair, that 10th month mark I remember being just a fantastic period of time when I looked at my wife and said, I have to comb my hair now, look at this. It was awesome.
I look at everybody as a treatment plan that we can provide for them. And if it's done properly, there's going to be a positive change here. There's going to be a cosmetic improvement, and they're going to look younger. And if you do that, you've now provided a service that, you know, they're going to be very happy with.